is World TB Day. Of course, the theme, Yes, We Can End TB. The spotlight falls on the ongoing challenges that are faced by individuals battling tuberculosis. Despite medical advancements, those afflicted continue to grapple with stigma and the dilapidating side effects of the treatment of drugs. Pfizer Maureen tells us her journey with tuberculosis in this report. Listen in.
On a day like today, the spotlight shines on individuals like Pfizer Maureen, whose journey epitomizes the challenges faced by those battling tuberculosis. Pfizer was diagnosed with TB in 2022, a moment that plunged her into a world of uncertainty and fear. Initially, she says, she grappled with the weight of stigma, feeling isolated and misunderstood.
I was diagnosed with TB in 2022, like a day today, World TB Day. We went for outreach as healthcare workers. Then I produced my sample. The sample turned out as positive TB. I took it negative.
But Pfizer's journey didn't end with diagnosis. She soon confronted the harsh reality of TB treatment, as well as the weakening side effects of medications that took a toll on her physical and emotional well-being.
I experienced some side effects of the drugs, like the swelling of the lower limbs, pain of the lower limbs, but that one did not stop me from continuing with the drugs. I continued with the drugs at the first phase. For those signs, I experienced the first phase. When I go to the second phase, they started disappearing.
According to Homa Bay County Director of Health Services Dr. Gordon Okomo, 40% of TB cases are still missing annually, according to TB Prevalence Survey report of 2016.
These patients continue infecting others, adding to the already big number of undiagnosed people. For us to find all people with TB, we need to realize that TB is everyone's business and therefore take responsibility.
Tuberculosis remains to be a threat in the country, rated as one of the killer diseases, especially prevalent in the rural areas. In January this year, the Ministry of Health, through Principal Secretary for Public Health and Professional Standards, Mary Modoni, launched a plan to combat tuberculosis in the country. The 5-year strategic plan aims to ensure quality care for TB, leprosy and lung disease for all Kenyans. Data from the Ministry of Health in November 2023 indicate that findings and treatment of TB have improved after a sharp drop in 2020. Last year, 90,841 people with TB were identified out of the estimated 112,000. Ann Odida, TV 47.